Yeah, thank you for coming, everyone. Hopefully you learn a little bit and have a good time, too. So I'll just give you a little background about myself here. I'm a dual-trained internist and pediatrician, board certified in both, and grew up in Hutchinson, Minnesota. And my wife's from the Iron Range, so we wanted to move up to the North Woods and love Grand Rapids. We spent some time as medical students with Dr. Cleary and Dr. Carlisle, and just really fell in love with Grand Itasca and Grand Rapids. So I'll start out with just a few basics, and then we'll go through a tour of different infections that are potentially preventable by vaccination. And how our vaccine's made. That's kind of an interesting thing that many people have never thought about. And a few common questions, kind of a question and answer style. The immune system is a super complicated thing, and some people spend their whole lives trying to study it, and doctors in general, we only know the tip of the iceberg about the immune system so far. This slide is just meant to illustrate that there's the innate immune system, which is kind of this reptilian immune system which can attack kind of any offender, and all it does is poke holes and stuff, and it's not really smart, it can't learn. But we also have the adaptive part of the immune system, and it learns from both infections, but also from immunization, and also when antibodies are passed over from mom to baby through breast milk and such. So, but mainly we're going to be focusing on that adaptive immune system, the learning immune system, and how immunizations impact that. The main way that the adaptive immune system works is by creating a lot of keys. So on this slide, the yellow shapes are to try to represent the antigens or the particles of a bacteria or a virus that we're going to try to attack. And then the Y shape represents the antibody. Our body is set up to create these Y-shaped keys for each of these individual locks. And every cold and flu you've been exposed to over your whole life, some of those blue Ys are still floating around in your bloodstream. But more importantly, the instructions are written down. So if you come into contact with something that you haven't seen in many years, sometimes you can still fight off an infection. And that's why the littlest kids get high fevers. Parents usually get kind of sniffly noses and not as severe symptoms. So this is actually a really detailed look at one of those Y-shaped antibodies. There's the drawing or the schematic on the lower right part of the corner, but the main part of the slide is the 3D picture of what an antibody actually looks like. So it's a really complicated, convoluted protein that attaches to these virus and bacteria particles. So this slide is just another slide to show us that it's a complicated three-dimensional geometric shape. And if you can imagine, this thing is going to interface with a protein from a virus or from some other kind of a particle. So there are many vaccine-preventable diseases and many, many vaccines out there. Any of you who took your kids in or have some grandkids probably know that there's a lot of shots that we do these days. And if we were going to talk about every single one of those infections for every vaccine, we'd be here for a long time. So I just picked some of the most interesting and important, and if I didn't hit on one that you want me to talk more about, I'll do my best. So polio is one of the ones that many people are most familiar with, and it pretty much started the vaccine revolution. Polio is a virus. It's also called infantile paralysis, and it's transmitted fecal-oral route. So virus is shed through the stool, and if small amounts of poop particles get into the hands or in the food, that's how it's caught. Many of you may remember that in the 50s, kids would go to the swimming pool and come home with a fever and a little bit of a cold and some body aches. And within a week or two, they have muscle weakness, they can't breathe, they're staying in the hospital. And thanks to Dr. Salk and a lot of people, including with the March of Dimes that sent in their millions and millions and millions of dimes, we got the very first vaccine in 1955, and kids these days, and even people my age, don't have any idea how serious that was. So the pictures are of a boy who's learning to walk again after he was affected by polio with braces, and in the bottom are the old iron lungs that when the muscles of respiratory, the breathing muscles were affected, they had to have something to do. Another one to talk about here is hepatitis B. So hepatitis B is a virus as well. It's spread by blood and bodily fluids. And we try to get the first vaccine for hepatitis B right in the hospital when babies are born. A lot of people think that's cruel because why are you going to poke this little baby? But babies are some of the most at-risk people for getting sick from hepatitis B. The most common way you would get it is from your mom or from a family member, but it's possible to catch it at daycare and other places too. And if infants do catch hepatitis B, they're much more likely to go into liver failure, which if your liver shuts down, you can pass away from that. So hepatitis B can also cause chronic disease. So some people feel totally healthy, they don't even know they have it. More common in Southeast Asia, for example, where they contracted it, it goes dormant in their body, but they're still able to pass it on to others. It's still able to reactivate if they get sick in other ways. So it's, all healthcare workers are generally vaccinated against hepatitis B. Tetanus. Tetanus is a bacterial infection. Clostridium tetani is the bacterium, and that bacterium produces a little toxin, or a little seed, if you will, that when that's in the bloodstream, it prevents the muscles from relaxing. And tetanus is found in soil, but we think about it with puncture wounds, so rusty nail. And it's not so much the rust or the nail, but it's related to where the rusty nail usually is, which is on the ground or at the barn or somewhere with soil and possible contamination. So if everybody who stepped on a rusty nail didn't get a tetanus shot, how many of those people would get tetanus? A very, very small percentage. But this is a artwork image from the Dark Ages, back when no vaccines or treatments were available for that, of course, and it caused serious spasming of the muscles of the whole body. Now another term for it is lockjaw, and we have some better antimicrobial treatments and stuff for that if we need to, but really prevention is the best. Pertussis, or the whooping cough, it's a highly contagious bacteria, Bordetella pertussis. This also causes kennel cough in dogs, super, super contagious. And it's a respiratory illness. Some of you may have heard that just real whooping noise that kids make when they get the cough. Pertussis is kind of a unique story because some families around the country are choosing not to vaccinate their kids for a variety of reasons. We'll talk some about that, I'm sure, throughout the talk. And so pertussis was one of those that started making a resurgence. And resurgences of things like pertussis definitely hurt kids, but it was hurting their grandparents the most. So most folks that are in their 70s and 80s had whooping cough when they were young. And this is one of those infections that the immunity does wean and wane over time. And so folks that had it when they were young thought they were immune to it, and then they were actually catching the whooping cough again. And especially if there are other health problems, you don't want to get whooping cough when you've got emphysema or getting treatment for cancer or things like that. So, so that was kind of one of the sad stories in the last few years about pertussis. Is there was a rise in fatal cases, and it was mainly in the elderly and, of course, little infants too. We've always done a booster at age 12, and now we're doing a booster for older adults too. So if you haven't had a tetanus for a while, when you go to get your update, make sure you ask for the one with the whooping cough component in it. And for those that are Medicare aged, the pharmacy is the right place to go, because for some reason that's where Medicare likes to pay for your shots these days. So Hib, Haemophilus influenza type B, is a bacteria that kind of mimicked influenza, which is a virus. But for many years, nobody knew exactly what it was, and then it was discovered that it's actually a bacterial infection. And if you were going to point at the biggest successes for vaccines, next to polio, this would probably be a close second. It can cause widespread infections, meningitis, ear infections, bad pneumonias, bloodstream infections, severe throat epiglottitis, which requires a breathing tube to be placed before swelling gets too bad. So this is one of those infections where especially infants were very, very ill with this. And folks that I trained with would routinely say that they had done so many different times where they'd have to see babies that had this, and they'd be doing lumbar punctures, which is that spinal tap, every time they were on call just for this infection alone. Dr. Cleary was telling me about this as well, and she had the same sentiment that it was just a horrible infection, and time after time babies were coming in very, very sick. She even remembered putting in a the spinal tap needle, and just pus, straight pus was draining out. So these babies would just be very, very sick, and many would pass away. So, but when the vaccine came out, as that little lower corner graph shows, the vaccine came out in the early 90s, and the incidence just plummeted. And I've actually never seen a case of Hib, meningitis, or anything like that. So it's basically been totally eliminated, and really, really been a benefit to our kids and everything. So mumps. Mumps is another virus one, and its main problem is it causes glandular swelling. So this is a kid who's got a parotid gland swelling on the side of his cheek there, and some swelling that's flown downhill a little bit. But the frightening thing is, in some cases, you can get permanent deafness that's associated with it, or infertility. It can affect the testicles as well. So this is one where there's really no specific treatment. It's kind of one of those, just a virus, we got to ride it out. So thankfully with the vaccine, we don't have to worry about the infection. Now this is another one where the infection was starting to make a resurgence, and in Iowa a few years ago, at a college, I think it might have been University of Iowa, there was a resurgence of mumps. So now human papillomavirus, this is a virus that causes cancer. And so for women, it causes cervical cancer. There are 140 different strains of this virus. This same virus causes warts on the feet, genital warts. It causes all kinds of different warts. So thankfully we have a vaccine now that covers the 9 high-risk strains that cause the cancer and the genital warts. Almost every adult that's been sexually active is exposed to this virus. So something like 90% of adults have at least one strain of this virus. So for some reason it's really hard to encourage families to get this one. I don't quite understand it, because it's a vaccine that prevents cancer. But many children, many parents don't want to think about their children doing adult things, and so that's the hard part there. We do want to get this vaccine in before kids are exposed to the virus, and so we started at age 12, but it can be done down to age 9, and even up through age 26, it's still recommended to do. So beyond that, it's probably not helpful. So I try to encourage everyone to get it, and really there's no long-term side effects to it. So some people have been worried that maybe infertility was related to it, but those studies haven't been shown. So it's a sexual transmitted vaccine. So at first just the girls got it, and then after a year or two it was quickly switched over to get all the kids to get it. So yep, so the boys and girls get the exact same vaccine. Even with the pretty crummy vaccination rate that we have in the country, it's like about 20 or 30%, something like that, the incidence of cervical cancer is dropping rapidly. And I think in my practice lifetime, the recommendation for women not to do pelvic exams will occur, because if all the girls now have this vaccine, the rate of cervical cancer will be so low that we don't even need to do the pap smears, because it's just such a low risk cancer and an invasive procedure at that point. And I guess maybe I'll take a little sidestep here. So there are a lot of people looking at our nation's vaccines. I don't have a specific slide to talk about this, but there's the vaccine safety database and system through the government, and any reported side effects are taken very seriously. An example of that is related to the rotavirus vaccine, which is a virus that causes really, really bad diarrhea in infants, and they usually require hospitalization if they get that diarrhea. Older like kids and adults and stuff just get a raunchy diarrhea, but they recover pretty okay usually. But it's the babies that are really sick, so the babies get that vaccine. And when that first came out, there was a slight increase in some of the studies that those kids were getting a problem with their intestines, where it was telescoping on itself. And that's called intussusception, and sometimes that can require surgery. So they pulled the vaccine immediately and re-looked at the studies, tweaked the vaccine, and since then it's come out and the incidence has been no different than the kind of the national average for that condition. And so they were very quick on that safety issue there. So a lot of people wonder, well, is anyone really studying these or doing anything about these vaccines. They just release them and nobody cares. Vaccines are probably our #1 most studied thing we have. We have millions and millions and millions of vaccines administered a year, and so a lot of safety data behind it for sure. How about meningitis? So the vaccine is against Neisseria meningitidis or meningococcus, and that's a bacterium. But meningitis is an infection of the lining around the brain, the meninges. And that picture up there is kind of little, but basically just the lining right under the skull is what gets affected. And these are the kind of kids where they're at college and they called their folks and said, I'm kind of sick, I'm going to take a nap. And then someone checks on them the next day and they passed away. And those are kids that get really, really, really sick fast. There are viral meningitis infections as well. Those are much slower and much less likely to cause you to pass away, but this vaccine just goes against the bacterial cause. Usually you're starting to feel sick over a couple of days. You've been exposed to the bacterium, and it's usually in close quarters like military or dorms or on a cruise ship or something where you're kind of confined together. The infection carries both a high morbidity and mortality, and what that means is the odds of you having lifelong problems afterwards are very high, and the chances of passing away are pretty high as well. So untreated, 50% of people would pass away with this kind of infection. And even with the best treatments we have, still 5 to 10% of these kids would pass away. So it's a really, really big, serious problem, and if we can prevent it ahead of time, that's our goal. Pneumonia, this is definitely one that affects all ages. It's a bacterial infection, pneumococcus or strep pneumoniae is the other name for it. And kind of like Hib, it causes many different types of infections, ear infections, brain infections, lung, it causes all kinds of stuff. So, but of course it's called pneumococcus because it definitely causes pneumonia, and the most common thing it does cause. Those with the weaker immune system are at risk for more of all of these things we've talked about, including pneumococcus. So kids and adults alike need to be updated on their vaccine for pneumonia. There's a whole list of different guidelines as far as who gets the pneumonia shot and when. For most people, you get it when you're a kid, and then your next one is when you're over 65. But if you have some associated health problems like heart disease, diabetes, emphysema, some stuff like that, then you should get a dosage when you're younger than 65. And then now there's also a new booster. So there's the 23 strain, there's the 13 strain vaccines, and we've been using both in children for a long time, but the adults typically were only getting the 23 strain, and now the recommendation is that we give the adults the 23 followed by the booster with the 13. And there is a little bit of overlap in those strains, but they cover more strains. It's not 36 strains, but I don't remember exactly how many it is. But it does not prevent against every kind of pneumonia. So, of course, this is just Streptococcus pneumoniae. There are other bacteria, there are other viruses. There's a whole slew of ways you can catch pneumonia. So this is just one bacteria, several strains of one bacteria, but it is probably 65% of all the pneumonias are this guy. So let's talk a little bit about how the vaccines are made, a couple of different ways here. There are a few different strategies. One is let's just use a little piece of a virus. That's how the Hepatitis B vaccine is made. They chop it into parts and give you those parts. Another one is similar, use a part of the bacteria. So tetanus, they use a couple of the different proteins in the tetanus bacterium and the little spore that they make, and then so your body sees those, but it's not an infection. It starts making those keys. It starts making a bunch of those Y-shaped things. Weaken the virus, like the measles vaccine, that's actually a living virus that you get injected with. But it's weakened to the point where it shouldn't do any harm, but those are ones where, boy, when someone's got active HIV, when they had recent chemotherapy, when they have serious immune system problems, we don't give those at that point. Or inactivated viruses like influenza. They give you the whole virus, but it's totally dead. It won't reactivate, it won't give you the flu, so yeah, you cannot get the flu from the flu shot. Side note, the flu mist was the spray version of the flu that was ineffective last year. Back to the safety database, it was only 7% effective. So that was really bad, but the shot was 70% effective. So the mist will not be available this fall, but the shot definitely will be. The flu virus mutates every year. So it's just a really quick process where it can recombine itself into different structure and patterns. And so the virus that you caught last year won't be the one that you caught this year. Same thing with the vaccines. They sometimes pick the same strains and then a totally new one comes out. That's when H1N1 came out and everyone got so sick. So the holy grail there is to get a flu vaccine that you don't need to give every single year, that's directed at some parts of the virus that stay constant, but no one's found that one yet. So a lot of vaccines are made in eggs. And what they do is they grow the virus inside the egg. And then after it's been in there for a few days, they extract the virus and purify it. And it takes a lot of eggs. It takes a long time. And sometimes this sciencey stuff is like in the background. It's like, well, vaccines just occur, you know, and they just kind of pop out of test tubes or something. But no, there's people injecting eggs and watching the eggs and make sure the temperature stays normal. And so that's part of the reason why the flu vaccine needs to be chosen early in the summer, because they have to pick a few strains and then start incubating the eggs, because they can't wait until September because it takes a few months to really make all those vaccines. So there are a lot of data too about people that have an egg allergy, that there's really not enough egg protein left in the vaccine to cause an allergic reaction. If someone has an egg allergy that's had a reaction from the flu shot, the recommendation is we can give it at the clinic still. We just watch you a little bit and it shouldn't be a problem, but some people still like to go to their allergist and get a very minuscule dose of the vaccine and ramp it up over time. And long story short there is they've gotten so good at removing the egg protein that it's really not necessary to do that part anymore. Cell culture, so they can grow some of these vaccines, the virus in the mammalian cells or animal cells, and it takes a long time, but it's not quite as long as the eggs. It's done more on like petri dishes, and it's a little bit quicker. They still have to purify it and all that kind of stuff. The holy grail is this recombinant process. So scientists try to select the most important proteins if they can, and then they insert the gene for that protein into another virus or bacteria, one that's benign, one that's easy to grow, and then they mix up vats of these guys, and they just have huge vats of bacteria or viruses growing in there, and then they can purify out the protein from the virus or the bacteria. This is exactly how they make our insulin these days too. They put that gene into a bacteria, and they have that bacteria just make tons of insulin, and then we just suck it out and purify it, and yeah, they're not grinding up pig parts anymore. That's how they used to make it. So this is super fast, but it's not feasible for every kind of immunization. And just because this is a new technology, everything moves very slow, very methodical, lots of testing, lots of following side effects and all that kind of stuff. So, but very soon our flu vaccines will all be made this way. Here's a few common questions that I get about vaccines, so I thought I'd go through a few of those. I heard about human tissue-grown vaccines. So yeah, some vaccines can only be grown in human tissues. And that's complicated, because where do you get some human tissues to grow these vaccines so we can purify the vaccine and then give that vaccine to kids, you know? It's tricky. So varicella, rubella, hepatitis A, and rabies are the ones that are currently grown on human culture. And they come from 2 cell lines, which were originated from 2 legally aborted fetuses back from the 1960s. So they're not repeatedly obtaining aborted fetal tissue. These are cell lines that have been continued along the years that are 50-something years old. These cell lines are, and they're able to coax the stem cells to keep growing using special baths and nutrition, and so they've been able to keep those tissues alive since that time. So it's not new tissues, but yeah, this is definitely one that everybody's got to kind of struggle with, related to their own religious, philosophical kind of background. I'm Catholic, and so I look at it from that point of view, and the Vatican definitely wants more research to be done to try to make these vaccines in other ways if possible, but they think that parents have a serious obligation to protect their children from preventable disease if we can, and just because a parent uses this vaccine for their kid doesn't mean you're approving of abortion. So the Vatican basically says go for it, but we're going to support the scientists to try to get around this if they can in the future. So can be kind of a hard debate for folks. How about aluminum? Should we be worried about that? It is present in some vaccinations, very, very small amount, and it's used as kind of a booster to boost the vaccine's effect, to allow for fewer doses, smaller quantity of the vaccine particle. It's kind of an acceleration factor. We actually have aluminum in our bodies naturally. It's present in the crust of the earth, and it's present in breast milk and formula in small amounts. So the only children that I know of that get toxicities from this are the very littlest infants that are in the neonatal intensive care unit getting many, many medications infused into their body over long periods of time, and then heavy metals like aluminum can build up. But for our kids who are getting their regular shots, they're probably exposed to more by eating dirt at the sandbox, you know, so it's small. And then what about thimerosal? Thimerosal has kind of gotten a bad rap, and it's a preservative that contains mercury, and a lot of this blew up related to autism, which is the next slide, but mercury is present in the water supply even. It's in small amounts. It's basically used in multi-dose vials to try to prevent contamination. It's pretty much been removed from every single vaccine except for multi-dose flu, and we don't even use that at Grand Itasca anymore. We just use the single-dose flus. But if you got a flu shot somewhere else and if they need to drop multiple doses from one bottle, they don't want to spread infection if they can help it, and so that's in there to prevent that. And honestly, it's a teeny tiny amount, and no studies have shown it's harmful to you, so I wouldn't worry about it. Do vaccines cause autism? So that's a pretty big topic, and some people say controversial, but if you ask doctors, we don't think it is, because the data is pretty definitive that no, it does not cause autism. Dr. Wakefield, who's a British physician who had a study back in 1998, tried to connect MMR, the measles, mumps, rubella, over to autism, and the long and short of that was that his vaccine study was flawed and his license got revoked. He's not able to practice medicine anymore. So that's how much the medical community feels that he did a disservice to our patients. And there have been many, many studies since that time, including one with over 500,000 children showing no connection to autism with vaccines. The real trouble is nobody knows what causes autism, and it usually creeps in somewhere between ages 2 and 3, right after you've gotten the most of your shots, most of your childhood shots. So it's a time correlation for sure, but whether there's causation there, it's definitely no causation that the studies have shown. So, but we don't know what causes it, so it's kind of hard to prove something isn't connected. That's a really hard scientific study to prove. But boy, there is a lot of data out there to say vaccines do not cause autism. But when your family has seen one child who got autism, you're really hoping to find anything that you can connect to that. So I totally appreciate that sentiment. That's way too many pokes. I don't want to give so many shots. A lot of parents say that. Let's just delay them. Can we do one? We'll come back for another one, and we'll kind of trickle them along. And vaccine delay causes infants to be susceptible to these scary infections for longer. Think about Hib, pus coming out of the back. Think about whooping cough. Think about all this scary stuff that we can prevent. So an infant's immune system is the weakest between birth and 2 months, and that's why the vaccine series starts at 2 months. So they're all super susceptible for that 2-month period, and then after that the immunity starts building and all that, but we don't want to delay that any longer than we have to. And yeah, like I said before, many times infants are the ones that most critically need the protection of these vaccines. Adults can pretty well handle it. The infants are very susceptible. Babies are responding to millions of antigens every day. So antigen, going way back to that slide with the lock and key, those are the virus and bacteria parts that our bodies learn from. And if you think of it, a baby comes out sterile and is exposed to the world and now has so many viruses, yeast, bacteria just pummeling their skin. And even if you think your baby is clean, you're instantly covered inside and out with bacteria, yeast, viruses, all that stuff. So, which is a good thing. We need some of that good stuff in our intestine and on our skin. But boy, the immune system is learning from literally millions and millions of components. So the few, dozen, probably upwards of about 65 components or so that we give is literally a drop in the ocean compared to all the different antigens that our bodies are learning from. I just put this slide in here to show it's a large number of shots in childhood, but we just have to keep thinking about all the horrible infections that we can prevent. This is going a little bit back to that part about the whooping cough that I talked about, where it started making a recurrence and an upward trend, and this is all related to people choosing not to vaccinate their children, and then the most susceptible are affected, the unimmunized infants and then the elderly. Which brings us around kind of to herd immunity. If you've heard of herd immunity, is a philosophy where even if not every single person is vaccinated, the more of us that are vaccinated, the more likely we are to stop the spread of a virus or bacteria. So in that middle box there, the red circle is the infected individual, and the blue are the vaccinated people, but the gray are just the people who haven't been vaccinated, or their immunity didn't last for whatever reason or whatever. So it's much easier for that red arrow to find a path to more people, versus on the right side, many more blue dots are present, and if the person is around 1 or 2 people that are unvaccinated, they may or may not get an infection, but the odds of it spreading around are very slim. Even if a few people don't get vaccinated, we're still pretty okay, but once a pretty significant percentage of the population is starting not to vaccinate, then we're more on the left side here, and people who thought they were safe and immunized are going to start getting sick again. So that's the baby that had the pertussis, and this is kind of their grandparent who now has pertussis again and thought they were immune because they were a kid when they got it, and so that's the kind of sad part there. California has a law that was just passed that you either have your kid fully immunized or they cannot go to school. And so more of that may come out, I'm not sure, but it's a delicate subject. There's a lot of reasons for not getting shots, religious objections and otherwise, and I don't know that a lot of those religious objections hold at least with Catholics, but it's a big world out there, but many people were saying religious, and it's really kind of a personal preference and stuff. So California took the religious objection off the table. So, but in Minnesota, you can abstain from vaccines if you like, and you still get to go to school. Yeah. There are a lot of resources available to you, and the CDC is probably the most reputable site. So if you ever want to read more about immunizations, definitely head there first. There's a really great article that's from the Children's Hospital of Philadelphia, which is also called CHOP. And it was created by Dr. Paul Offit, this handout, who is the nation's pediatrician advocate for immunizations. And if you've seen a doctor talk on CNN or like the Ellen DeGeneres show or something it was probably Paul Offit, and he is a tireless advocate for shots. So it has some of the questions we've talked about and some others, like common reasons why people choose not to get vaccines or think they're dangerous or scary. So yeah, Dr. Paul Offit has his own website that's excellent as well. So a lot of vaccine-preventable diseases, but there's a lot that aren't too, of course, And really prevention is the best medicine, and immunizations are all about prevention. So if we can exercise and eat healthy and get our shots, we can prevent things a lot better than we can treat them down the road. And they can really help us reduce our risks for diseases, disability, death, and they're amazing. Many doctors would say that vaccines are the #1 best thing that we ever were able to do for humanity.
Thanks again.
Thanks. Thank you.